Hello, my name is Dr. Dewan S. Raja. Today I will discuss about femoral hernia. What is femoral hernia? A femoral hernia is a protrusion of abdominal content, usually pre-peritoneal fat or loop of small bowel, particularly the ileum, through the femoral canal, emerging below the inguinal ligament, medial to the femoral vein, and lateral to the lacunar ligament and pubic tubercle. It is below and lateral to the pubic tubercle. It accounts for only 3 to 5% of groin hernias, but is far more common in females, particularly in post-menopausal women, due to wider pelvis, relatively narrow femoral vessels, and laxity of the muscles. Epidemiology more common in female, particularly elderly women after the age of 50. They have wider pelvis, larger femoral canal, relatively narrower femoral vessels, accounts for less than 5% of all hernias, frequently present as emergency due to incarceration and strangulation. Risk factor multiparity, chronic cough, constipation, increased intra-abdominal pressure, older age, post-menopausal women, low BMI, less pre-peritoneal fat. Symptoms of femoral hernia: groin bulge below and lateral to the pubic tubercle. Bulge increases with standing or straining, may be painful or asymptomatic. Symptoms of small bowel obstruction in strangulation, colicky abdominal pain, vomiting. Signs: tender mass inferolateral to the pubic tubercle, inferior to the inguinal ligament, irreducible in many cases. Okay, because the hernial sac goes down along the femoral canal, may come out anteriorly through the saphenous opening. So this is the femoral sheath. This is the medial compartment. We call it femoral ring. This part we call femoral canal. So part of the small intestine, particularly the lower part of the small intestine, ileum, may get in through the femoral canal. Okay, may come out through the saphenous opening. And this is the hernial sac here, hernial sac, and this is the neck area, so the content goes through this. And this is this bulge below and lateral to the pubic tubercle, below the inguinal ligament, lateral to the femoral vein. How can we do? What are the complications of femoral hernia? Incarceration, strangulation, most common among all hernias. So it will be twisted, it will be adherent in the sac. Bowel obstruction, small intestine may be obstructed due to strangulation or incarceration. Then we may get abdominal distension, and the strangulated bowel go through necrosis, cell damage. There will be peritonitis, inflammation of the peritoneum, and it will have high mortality if untreated. Differential diagnosis is inguinal hernia, femoral lymphadenopathy, saphenous varix, lipoma, Schwartz abscess, femoral artery aneurysm. So, how can we diagnose femoral hernia? Certainly, clinical examination, femoral hernia location below inguinal ligament, lateral and below to the pubic tubercle, medial to the femoral vein in the femoral canal, going to the femoral canal through the femoral ring. Usual content is part of the small intestine, particularly ileum. We can also do the ultrasound to confirm the hernial sac, bowel loop, especially useful in women or an obese patient. We can do CT abdomen, pelvis, best for complicated hernias and preoperative planning. What are the differences between femoral hernia and inguinal hernia? Inguinal hernia are two types, direct and indirect inguinal hernia, but both the direct inguinal hernia are initially above the inguinal ligament. Okay, it is above the ligament. Indirect inguinal hernia may go to the bottom of the scrotum, and the direct inguinal hernia go to the upper part of the medial aspect of the thigh, okay, in the upper part of the scrotum, it may go there. But femoral hernia is always below the inguinal ligament. Relationship to the pubic tubercle, femoral hernia is inferolateral. Inguinal hernia, both direct and indirect, are superomedial. Okay. Common in female, inguinal hernia is common in males. Risk of strangulation very high. Inguinal hernia risk of strangulation is less. A lot of people may go with inguinal hernia for many years. Passes through femoral canal, and indirect inguinal hernia goes through the inguinal canal through and through from the deep inguinal ring to the superficial inguinal ring, then going to the scrotum. Direct inguinal hernia pushes along the posterior wall of the inguinal canal and comes out through the superficial inguinal ring. Urgency, surgical urgent, surgical it is urgent, femoral hernia. Inguinal hernia, elective unless complicated. Femoral hernias are never treated conservatively. Urgent surgical repair, especially incarcerated or strangulated, approaches include low, high, Luthesian, or laparoscopic. These are the management. So we need surgery. This is mandatory. In femoral hernia, there is every chance of incarceration and strangulation. And that's all about the femoral hernia. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.